to. All right. Is everyone able to see my screen?
Yes.
Yes.
Awesome. Thank you for whoever answered. Okay, so this is the Delaware COC's April quarterly meeting. And for the agenda today, we're going to go over a little bit of COC business. We're going to have a couple updates on some community things like around housing, like the EHVs, CARES Act spend down legislation. And then we are going to have a presentation from DSAM around navigating their services. And then we just have a couple of upcoming events and announcements to go over. So the first thing we're going to look at in terms of COC business is COC funding. This is just a little bit of an overview of COC funding for those who might not be super familiar. HUD COC funding is an annual competitive funding application for the type of homeless assistance dollars that this funding stream offers. The application has 3 different parts: the projects, the existing and new projects that apply, the COC's application, which is on behalf of the entire community, and then the COC has to rank and score projects in order of priority for the community. We do have a couple of hyperlinks within the slide, so if you want to know more about the application, you can just click there and it'll take you to HUD's page on that. Same thing with COC project types. It'll take you to more information there, but COC funding can be used for permanent supportive housing, rapid rehousing, transitional rapid rehousing, and several infrastructure pieces like our data entry system and our coordinated entry and our planning. In fiscal year 20, HUD funded 29 COC projects across 7 agencies in Delaware. So you can see all of them there. And you can also access any prior awards in the archives. In fiscal year 20, we funded 18 PSH projects. So PSH is the primary funding that we have in Delaware for housing services, and then followed by rapid rehousing, transitional rapid rehousing, and transitional housing, and those infrastructure pieces behind that. In fiscal year 21, we were awarded very close to $9 million, which is super, super exciting. It's the highest award we've ever gotten, and we increased from 29 projects to 32 projects. We got 3 new projects totaling around $700,000. There are 2 new PSH projects and 1 new transitional rapid rehousing project. Renewal projects came in at a majority of the funding, which is just securing what projects already receive. And the fiscal year 21 grants are able to begin operating in 2023 and will expire in 2024. This graph here just shows our funding amounts in 2021 by project type. So you can see again, we have the most PSH projects, so that's where most of the funding sits, and following the same distribution kind of as the number of projects we have that you saw in the previous chart. So that's it for funding. That's just an announcement to the community that we received our fiscal year 21 awards, which is really exciting. And now we will be going into the 2022 competition where we get to apply for all of that stuff all over again. For the 2022 PIT, this is a little overview. I'm not going to spend a lot of time here, but just information on the point in time count for those who might not be familiar. It's an annual count that we do here of homeless persons experiencing homelessness in the state. So it's unsheltered homelessness, sheltered homelessness, and any other requirements put forward by HUD. And PIT data plays a critical role in our competitiveness for COC funding as a community. Our update here is that we did do a volunteer feedback survey. We did not get a lot of respondents to it. The response rate was around 18%. But if anybody is interested in looking at those results or the kind of questions that we asked, you can access that by clicking that link. Our submission time for the PIT data is April 29th, 2022. As of last week, we completed all of the data entry for the PIT, and right now the process of data cleanup, which includes validating the data and any error corrections, is in process now and being completed by our CMIS team. And we're on track for submission prior to the deadline. And next steps after that are to begin drafting the 2022 PIT report, which is a narrative report that details the outcomes from the PIT for the community. An update on system performance measures. Again, just a little overview here. HUD has 6 main system performance measures that you can see across the top row there. And system performance measures are a report on the entire system of all funding streams and all project types and all providers serving homelessness in Delaware to give you a comprehensive or a more comprehensive look at how the community as a whole is preventing and ending homelessness. So HUD uses system performance data as another factor in the COC funding competition, and the system performance measures allows communities to evaluate and improve upon their community performance. So for the fiscal year 21 system performance measures, they were submitted on time prior to the deadline by the CMIS team in early February, or late February, early March. The reporting period there was October 1st, 2020 to September 31st, 2021. So it is a significant chunk of COVID times. And the next steps here are to review the system performance measures with the System Performance Committee and begin drafting the fiscal year 21 system performance report, which is another narrative report that helps provide context to the measures and outcomes, any changes from the previous year, and helps propose strategies for improvement. So if anybody is interested in joining that meeting and looking a little bit deeper into our system performance measures, you can access the meeting there utilizing that link. And it is next week. Just some immediate highlights from the system performance measures. So 44% of all people who exited a homeless assistance project exited to permanent housing destinations. So 44% of people who entered a program exited to a permanent housing destination. 15% of all households that exited homelessness to a permanent housing destination returned to homelessness again in 2 years. So that is a relatively low returns rate, which is really good. 98% of people in a permanent supportive housing program either remained in their or who exited to permanent housing remained in their project or exited to another permanent housing destination. The average length of time homeless, I don't know why homeless is capitalized. Anyway, for persons served in emergency shelters increased from 72 days to 80 days in fiscal year 21, but decreased for other project types. That it was to be expected with the length of time that people were staying in emergency situations throughout the pandemic. And in fiscal year 21, 80% of people who experienced homelessness in Delaware were homeless for the first time, compared to 73% in fiscal year 20. Right, and that is it for me. I am going to pass it over to Rachel to give an update on the emergency housing vouchers.
Hi, everyone. Good morning. You can go ahead and go to the first slide. So many of you might remember, feels like it's been a really long time, that what feels like a really long time ago, maybe I think in the fall of 2021 or summer of 2021, the Continuum of Care Board hosted a feedback session for COC members and partners to talk about how we might, how we would best make use of the emergency housing vouchers that HUD made available to our continuum of care with some of the rescue plan federal relief money. These emergency housing vouchers were new housing vouchers. They function pretty much exactly the same as a housing choice voucher, but they are targeted specifically to meet the needs of people who were recently homeless or experiencing homelessness currently. In Delaware, we received all three of our public housing authorities received 140 emergency housing vouchers total as a state. And those vouchers are administered by the three largest housing authorities in our state, the Newcastle County, Wilmington Housing Authority, and Delaware State Housing Authority, which covers Kent and Sussex counties. One of the big differences between the emergency housing voucher and other forms of public housing voucher assistance is that one of the requirements that HUD put in place was that the COC be involved in making decisions about who gets access to this resource, why, and how, and that referrals for emergency housing vouchers come through your local coordinated entry system. And so here in Delaware, that's centralized intake. So the COC board reviewed the guidance, with the Public Housing Authority folks, hosted a feedback listening session, developed a process for helping homeless families and people get access to emergency housing vouchers. And we have some updated data that was updated as of the end of March. So it's a couple weeks old now and things change every day. But this is the most recent snapshot we have about emergency housing vouchers here in our state, and we wanted to share it with the full COC. So out of the 140 vouchers that our state received, the centralized intake program, which again is our local coordinated entry program, has approved 137, and actually I think that might have just gone up in the last couple of days. But as of the end of March, 137 households, whether they be families or singles, for emergency housing vouchers. The graph on the right, and you'll see the graph on the left, you'll see at the top, it's broken down by county. That was based on availability for referrals. So the way the COC here in Delaware decided to operationalize these housing vouchers, which many of you know, I see many of you who are doing the work every day to help people access and house people with these vouchers, so thank you, is that our rapid rehousing providers are doing the real work of connecting with the homeless household, helping them apply, helping them through the process with the Public Housing Authority, helping to identify a unit in the community and move in with that voucher and get approved for that voucher. So living situation at the time of referral, you'll see that most folks, well, 55 folks were in congregate emergency shelter at the time of a referral to an emergency housing voucher for consideration and approval. About 29-30 were in a hotel or motel in a non-congregate shelter setting, in most cases being paid for by DHSS and the state service centers. A little over 20 were unsheltered. And then the next number, the 14, that's folks who are already in a rental unit with rapid rehousing. So one of the things that our rapid rehousing providers could do, they could identify folks who were already in housing units in their programs that were not going to be able to stabilize without additional housing subsidy and assistance. Many of those cases were folks who had fixed incomes, disabling conditions, were relying on SSI or SSDI income, and were able to make use of a voucher to be able to stabilize and stay in that unit. Erin, you can move to the next. Centralized intake, EHV approvals by household type. So 39 adult only, 76 one adult with children, and 22 more than one adult with children. So the majority of referrals being families with children. Most folks had been connected to, again, this is as of the end of March, had been connected to and enrolled in rapid rehousing. Some were very recent referrals that we wouldn't expect to be enrolled. Some didn't end up, so that 16, some folks did not end up being enrolled because it may have been that by the time the connection was made, they were determined not eligible for a voucher, or they had moved to Connecticut to be with family. So there's a lot of different situations that can happen that would make someone not end up being enrolled. And then there were some families that were displaced by Hurricane Ida that have been working with DHSS that were not referred through the rapid rehousing process. So that's the extent to which people are getting connected from referral to that assistance with rapid rehouser agencies in our community. And Erin, you can go to the next. So this is where we were at the end of March. We had a total, and actually you can go to the next one. I'm gonna skip. So here's what you can see. Oh, and the colors changed, darn. Okay, so the colors must have changed when it got put into this format. So I apologize, folks. So if you look at the bottom, the data along the bottom line going across, that's where we were in January of 2022. Centralized Intake had approved 86 homeless households for to apply for an emergency voucher. 56 had been enrolled in rapid rehousing. 51 vouchers had been issued or approved, and only 4 had been actually leased up in the community. We've made a lot of progress since then. A lot more folks have been referred. A lot more folks have been enrolled. More than double number of EHVs have been issued and approved. And we are at a place in our community right now where since March, I mean, we're very close to almost all vouchers being issued and approved in Delaware. But we only have 17, again, as of a few weeks ago, that are actually leased up in units in the community. This is a big concern of ours. It's a big concern of the COC board, who have also been having conversations about this issue, who have had access to this information and data. One of the big things that we have been talking about is, there were it was a little slow going getting things issued and getting vouchers issued because it was a new process to the community. It was a new process for the providers to learn. It's a lot of paperwork. There's a lot of eligibility criteria, right? You name it. But now we're at a place where a lot of people have vouchers in their hands that they simply aren't able to use to be housed in the community. And that is a very different challenge with regards to actually getting access to affordable housing in the community, identifying landlords who are willing to work with voucher holders, et cetera. So we wanted to share this information with you all. I will note, if you look on the HUD website, it does not show that there are 7 there. So HUD has a special dashboard, federal dashboard, where they're tracking online EHV voucher lease ups throughout the state. And you can actually look by public housing authority and by COC to see how many EHVs have been used in your community. If you look on the HUD site, it does not reflect 17 leased up in Delaware. It looks a lot less than that, actually. It has to do with like data reporting. These are the real live numbers that come from the real live public housing authority folks here. I know Ray's here. I know Michael's here. I can't see everyone on my screen, so I know there are probably some folks here from DSHA or Newcastle County, from the PHA. So these are the real live PHA numbers locally of number of leased up vouchers, which does not match what's on the HUD website. So I'm definitely open for conversation and discussion. Again, members of the COC board should feel free to chime in here if you want to add anything. We wanted to just update everyone. This is a really new and exciting resource. And we want to be able to show that our community can make use of it so that we can get more. For those of you who've been working in the homeless assistance field for some time, having a housing voucher that is specifically for people experiencing homelessness feels almost like it should be a magic. It's like something you've wanted your whole life, right? Something that you could have only ever imagined. And while we only have 140 of them, we want to make sure that we can put those to good use so that we can get more as a community and house more homeless folks. So the issue with lease up challenges is a big one. And I'm open to people sharing their thoughts and comments and concerns.
Just had a quick question, Rachel, because I know a couple of months ago, there was a statistic put out that rental rates rose in Wilmington in spite of the pandemic. People in Wilmington, do you think they have the ability, they call it porting out, to maybe go other places in Delaware where the rental rates haven't risen as steeply? Because it is a supply issue. You have a voucher, you can't use it. Do you have that ability to move throughout the state to access affordable rental housing?
Yeah, so EHV vouchers are portable in the same way that housing choice vouchers and other types of vouchers are from one public housing authority to the next. It is a process. I don't know the details of that process, but they are portable. So someone can can have a Wilmington Housing Authority voucher in hand, be looking for a unit in the city jurisdiction, not be able to find one and decide, hey, I want to, you know what, I want to move to Kent County anyway, because my family's down there. Let me transfer this to DSHA. Let's see, Beth, who works with, where's Beth? Catholic Charities. I can attest to the fact that it's hard for my clients to use their vouchers. She just had to port one of hers to Wilmington from Sussex. Was that Sussex or Kent? I assume it was either Sussex or Kent, Beth. So yeah, that porting is happening based on unit availability and where people need or want to live and look for housing. So if anyone knows any really any landlords who aren't in the game that want to be, please feel free to reach out to me and the COC board, and we can share that information with our partners and providers. Judson asked, how significant is the problem with landlords not accepting the voucher? I have only heard that that is a significant problem, but I will let some of the folks doing the actual work speak to that if folks want to respond. I'm
happy to jump into that one.
Go ahead, Stacy. Thank you.
We use vouchers all the time for other programming, and it is a complete struggle to find a landlord, number one, and then number two, that has available units, and then number three, that are in safe areas, and then that aren't price gouging at this point. So I mean, we're finding a lot of landlords that have, spaces in not so good areas that used to go for maybe $800 a month that are now, up in like $1,400 range for the same exact location, same exact space, the whole nine. So we're definitely struggling with that. And then we're also struggling with them choosing to accept the vouchers. A lot of them are finding it difficult to work through DSHA, not to throw anybody under the bus, but they're finding the process difficult and lengthy. So they're choosing not to go with it. So we are definitely struggling in that area.
Thank you, Stacy. Anyone else want to add?
So this is Paul. I've spoken to the private sector of the biggest landlords in Delaware, and they're all telling me they have waiting lists. Where I think we've seen a change is in the small moms and pops providers who might have had 5 to 10 rentals. A lot of them are getting out of the business, and that's creating part of the crunch. The other part is, I didn't realize this, the big landlords that have now, there's a modern technology, algorithms are being sold to these large providers, and rents change and increase like airlines almost based on market issues weekly. And so, the demand is up, the supply is down. We haven't really created much housing, period, let alone affordable housing, throw in Airbnb and other stuff. And it's a huge problem in Delaware. And unless we start creating more market, people are going to have to either port out or move out just for housing, because it's not sustainable right now.
And I would add, Rachel, when we say port out, all the counties are experiencing that same thing. So we might think that it's better in Sussex, and it's not. So.
Yeah, I think that at one point in time, it may have been true that there were potentially more available units in certain places than others, but I think every market right now is really tight, and the units just aren't there across the board.
Yeah, when I'm saying poured out, I'm talking about porting out of Delaware.
Yep. Because that is something that you can do.
And in some cases, it's not a bad option. In some cases, it's a nightmare. So.
Yeah. So thank you to those of you who are doing this work and getting folks housed every day. I know just last week, we had 2 new families move in with EHVs, so it's happening. It's just moving a lot more slowly than anyone wants it to. And I think that this is shedding a lot of light on the housing situation here in our state. for certain members of our community. So thank you all for your work on this.
Rachel,
Yes, Deirdre, go ahead.
I did want to add something.
Yeah,
I think
please.
that as you know, as we move forward, and if the state is going to consider accepting more vouchers in the future, if that's going to be a thing, I think that it would be so much helpful for our providers who are trying to walk our clients through this process if the housing authorities, as wonderful as they are, operated very similarly. They're very different.
Yeah.
And I think that that's just been how it's been here in Delaware. But I think that that is also a challenge in that you, depending on the housing authority, plays a role in how quickly things move, which can be frustrating, not only for us as providers, but for our clients as well. And so, hopefully, if in fact that, again, if we accept more vouchers or more brought into the state, I would hope that perhaps the COC would take the lead in addressing that issue, because I think that it would make a difference. So I do agree with everybody who's spoken about the increase in rents, and it is very expensive and just kind of going up. But I did want to share that.
Thank you, Deirdre. Yeah, streamlining the process, making it, because if you're working with 5 people and they're applying to different housing authorities, you have to do a different process for each person. It's a huge administrative challenge. Renee, did you want to share something?
Yeah, just real quick. I'm sorry I'm a little late. Hey, Paul, I was listening to Paul, and I just wanted to share on this call the humongous challenge that we have here at the state service centers. We are partnering with the Division of Social Service to assist with case management for those that we have housed since March 2020, the beginning of the pandemic. And we meet weekly. And one of our latest statistics is that we have over 550 households throughout the state that we are housing. So you can equate that to probably about 1,200 or more people. And the challenge that we have trying to transition them out. So just wanted you all to know that there's so many people that still are being housed safely. But of course, we want them to move to get more sustainable and permanent housing.
Thank you, Renee. Appreciate that. It's really, I think, an unprecedented number of people that are relying on that hotel motel assistance, more than 2 years out from when DHSS started taking more folks in and supporting more folks that way. So thank you, Renee, for what your team's doing. And I know that a lot of the rapid rehousers are continuing to work very closely.
I wanted to thank them. We've had so many partnerships. Thank you all so much for the numbers that we have. Several hundred have been able to transition out. So thank you.
Yep. But as you said, it is often a supply and access issue. So, okay. Well, for the sake of time, I want to make sure that we are able to move on. Folks should feel free to continue to ask questions or share thoughts or comments in the chat. I'm going to hand it over to Erin to make sure it gets where it needs to go next. Thanks, Erin. Thanks, everyone.
Thanks. So next we have a CARES Act spend down update, and that would be ESG CV and CBG CV. We have updates from DSHA, Newcastle County, and some other resources. So for DSHA, they administered 22 different grants with their ESG CARES allocation, 1 street outreach project, 2 prevention projects, a data entry CMIS project, rapid rehousing, and emergency shelter. Out of all of those, 94% of their funds have been drawn down, and 14 out of 22 grants have been fully expended. All their COVID grants end August 31st to 2022. No draws will be accepted after that date, no exceptions. And if anybody has any questions, please reach out to Alice. Unfortunately, she wasn't able to be here with us today. And for Newcastle County, they had two different allocations. In the first one, you can see kind of a breakdown of what their allocation was and where it went, largely emergency shelter and rapid rehousing. Currently, they are about 93% of the way spent down there. And for their second one, they received quite a bit more. So there was more of a distribution of project types. And this one is only around 22%. And this is really important because 100% of ESG CV funds have to be spent down by September 30th, 2022, or else they are being recaptured by the government. So for the two, or by HUD, basically. So for the two allocations that are in the 90s, that's super great. But for everybody who falls into the second category, that's only 22% drawn down, we highly, highly, highly encourage you to get on that because if it is not drawn down by the end of those grants, that money is going to be lost to the system. Here, there's just some additional like resources that have different spend down strategies and different eligible costs and things that you can use those ESG CV funds for. So you can click on those and find those documents there. So that's it for ESG update. And next we are moving into Delaware legislation. So I'm going to pass it over to our advocacy and policy co-chairs, Nick and Tony.
Good morning, everyone. Tony, are you here as well?
Hey, yeah, good morning, Nick.
Hey, all right. Well, we are so happy to be with you today. So Tony and I are the co-chairs of the Policy and Advocacy Committee, which we have to give a shout out and say that we are always, always excited to have new members. So if anyone would like to join, we would love to have you. And Tony and I have been doing some legislative work on two bills in particular, although we're also going to cover SB 167, and we are so excited to tell you more about them. All right, can we go to the next slide? All right, Tony, you're up with 101.
Great, thank you, Nick. So Senate Bill 101, we hope that by this point you're all very familiar with this bill as our legislative opportunity to implement a statewide right to representation for low-income tenants who are facing eviction. Also part of the bill, we're including what would be included as an eviction diversion program that's designed to help resolve payment and other issues when, once a landlord goes forward and files for an eviction. As of the end of March, 101 is passed out of the Senate committee and is now heading toward the House floor for consideration. So once it, depending on what happens in the House, it'll then be sent back to the Senate for a final vote. At this point, in terms of getting involved, like I said, the most important part is going to be talking to your House representatives. Nick and I have been, for a variety of bills at this point, have been putting together kind of organization, letters and support letters, and are happy to share what we have. If your organization or you individually are looking to contact your House representative, showing your support for 101, we're happy to provide contact information for reps, and again, provide any type of form letter that we have to get the word out and support for 101 as it heads to the House for a vote. Aaron, you can head over to the next slide.
That is me. Thanks, Tony. So Senate Bill 90, which Rachel spoiled my big reveal, was recently passed by the entire Senate, which is so exciting. And what this bill does is eliminates discrimination based on source of income. So when you look at the non-discrimination in the fair housing legislation, it prohibits discrimination based on gender, based on race, but one discrimination that it specifically allows is discrimination based on source of income. So we always like to say that that can include people who receive Social Security or receive pensions, but a lot of times what it means is vouchers. And you guys gave me a great lead up to this by mentioning that we have really had a lot of trouble finding landlords who are willing to accept vouchers. So this is a major problem with accessing affordable housing. So what this bill would do would be eliminate that so that landlords have to consider the tenant as they are, instead of just deciding that they're not going to consider anyone receiving a housing voucher. So the current status is that it was passed by the whole Senate. But next it goes to the House Housing Committee, which is going to certainly be a tough fight. Anyone who watched the hearing on SB 101 will remember that that was quite a hearing. So this is going to be a tough one. So anyone who can provide support, contact their legislator, particularly if your legislator is on the Housing Committee, we would love your support. And as Tony mentioned, we are so happy to help you. We are so excited if you're excited and willing to give you any support you need to contact them. I just wanted to, we had some discussion about the Housing Mitigation Fund as well. So I wanted to give a quick mention of SB 167. The bill has been very much linked with SB 90 because one of the major criticisms of SB 90 from landlords has been concerned that they're not going to be able to access the mitigation that they need. The current fund, which DSHA runs and does a great job with, caps the amount of restitution that a landlord can receive. So this bill makes some changes, and I would say technically makes it a little bit easier for landlords to access it. So the bills are being very much heard together. I would say if we hear 90, we're going to hear 167 as well, probably the same day, just to kind of sweeten the pot a little bit for landlords who are concerned about admitting tenants who are receiving housing vouchers. Okay, I think that's it for this slide. And again, we've said this 100 times, but we love having people on the Policy and Advocacy Committee. If you can't tell, Tony and I are massive policy nerds who love talking about policy. If that sounds like you, or you're someone who wants to learn, we'd love that too. Please contact us, let us know. So thank you, everyone. If you thought this presentation talking about legislation was fun, we would love to have you.
Thank you, Tony and Nick. I did go ahead and throw links to where you can find who your legislators are, House and Senate, as well as a template that the COC created for an SB 90 support letter. So those are available for those who are interested and want to join the support. And I will now turn it over. Oh, John, go ahead, John, before we move on.
So, because I just can't help myself, Classy totally supports SB 90. We think we have some concerns about the mitigation fund, and I just want to air those so that people understand what they are. The potential problem with the mitigation fund is that if money is paid out to landlords, how will that affect the participation in the Section 8 program or the SRAP program on behalf of the tenant for whom the monies were paid? And so we have some concerns that because tenants really don't have, existing tenants don't really have a significant role in that money will get paid to landlords. A claim will then be established against the tenant, and the tenant really won't have the opportunity to dispute that claim. And so I wanted just to know, and then, so that's just, again, I'm not saying we oppose it, but I'm just telling you, I think there are some concerns. And then the other sort of big concern that I think I'd be negligent if I didn't mention is, if you looked at the vote in the Senate, which was great, it was 14-7 on the SB 90, which was a party line vote, and it was 21-0 on the mitigation fund. I have, and while they absolutely are being considered together as a practical matter, that actually is not a legal issue, right? It is quite conceivable that the mitigation fund will get passed by everybody and SB 90 will get voted down. So I think that's another just caveat here to be for folks to be a little bit careful on, right? So I think it's not, while everyone agrees that they are being thought of as together, they're not. It's not one bill, it's two bills, and there is nothing to stop the House from having different results on the two bills. So I just think there's a little bit of caution there about that. Again, I have no problem with what Nick said, but I just want to sort of note that it's not quite as 100% go, whereas I think on the Senate Bill 101, absolutely, right? Yeah, we are very much involved and supportive of Senate Bill 101 in full form. So anyway, I will stop being annoying and be quiet now.
Not annoying, John. I think that's important. Thank you. One thing I'll add is that all of that is correct. One thing I will just say is our hope in the House is that it will be done the same way that it's done in the Senate. Again, I don't have like confirmation stamp of approval that that's how it'll happen, but I know in the Senate, Senator Lockman introduced the one bill, SB 90 first, and if that one didn't pass, she wasn't even going to introduce on the floor 167. So hopefully the same approach will be taken on the House side, and we'll be working to try to make sure that happens. Paul, you unmuted yourself, so I wanted to, did you have something to share?
No, John, just check your inbox on the messages. Thank you.
Thanks. And thank you very much for our advocacy and policy committee members for being so active this session in this really important work. Thank you, Tony and Nick.
Awesome. So we are going to go ahead and pass it over to Alexia Wolf and Mikhail Wint, sorry if I said that wrong, for their presentation about navigating DSAM services.
Thank you, Erin. And Mikhail, if you want to lead off with the information on the Bridge Clinic, I'm happy to follow.
Okay, 1 second.
Thank you.
Just want to make sure I have everything up and ready for you guys. All right. Can you guys see me?
Yes.
Okay. All right. So you said to start up with the Bridge Clinic?
Sounds great.
All right. Go ahead and share my screen. All right. Does everyone see my screen? All right. So hello, everybody. My name is Mikhail Wint, and I am the systems analyst for the Bridge Clinic. So what I'm going to do today is just go through a couple good and very important things in regards to DSAM's Bridge Clinic and how it functions, as well as kind of intermingles with all the rest of the services within the state. All right. So the first thing is understanding the Bridge's mission. The Bridge Clinic's mission is to promote health and well-being by educating about and promoting awareness of and bringing access to the services that it can make a difference. We make sure that, well, not make sure, because we work so closely with other DSAM services and it is a community-based agency, we make sure that we are continuously working within community, whether it's doing outreach, whether it's working with the Hope Center, which we'll go over a little later. We're really just partnering with any other agency or any other, so that way everyone knows that there is the availability of help and that they're not alone to get it. All right. So the Bridge Clinic itself has 4 sites. There is the Sussex County location, which is located in the Thurman Adams building. There is the Kent County location that's located in the Dover Social Services building. Unfortunately, I can't remember the name of it at the top of my head. There is also the Newcastle site that's located right around the corner from DPC. And then we have essentially a floor within the Hope Center itself. I believe most of you will be already familiar with the Hope Center, but I'll go over that in a little bit later. So as far as referrals, for the Bridge Clinic, all sites with the exception of Hope Center, we accept walk-ins. We accept referrals from police officers, other agencies, hospitals, DPC. Essentially, anyone who needs help, we welcome them to reach out to us, and we try to connect them with the resources they need. So as far as the resources, we do the treatment initiation, engagement, re-engagement. We do provide a level of short-term and acute outpatient services. So for instance, if we refer you to a outpatient provider and for medication, let's say, and your appointment isn't for, let's say, 2-3 weeks, we can actually bridge that with our own therapists and nurse practitioners and such to provide some medication, alleviate that way. All of our, or at least majority of right now, our clinicians, our social workers are licensed. So they do brief therapy in order to bridge those gaps as well. Any questions about anything so far?
Mikhail, there's a question in the chat. Is this solely for opioid treatment and opioid use disorders, or is it for all types of substance use disorders and assistance?
Okay. Sorry, I missed that one. It is originally for opiate use disorder. However, treatment-wise, it's the entire spectrum. So as long as there's substance abuse or mental health, those are the core functions. But we assist in any issues at all, including homelessness. That's not to say we have all the answers, because a lot of people on the panel have already said that finding housing is not the easiest task right now. But we do still welcome, individuals who are seeking housing and do assist with trying to connect them with other agencies who may have housing, if not be able to find it on our own. But no, you don't have to have an opioid use disorder.
Thank you.
Mm-hmm.
There are no other questions in the chat at this time.
Gotcha. Oh, man, it's not working. There we go. I guess that was so as far as who is the Bridge Clinic for? All Delaware residents that are 18 and above. Unfortunately, we do not service minors. We also at this point do not bill, essentially. So there's no fee for service. Regardless of your ability to pay, we will make sure that you get services.
There is another question in the chat. Could agencies working with homeless individuals who are found to need these services make referrals?
Yes. We accept referrals from every resource. So let's say, if someone who works with the homeless population, if they found that someone needed mental health medication or to receive some level of support, they could refer directly to us, whether through walk-in, phone calls, or through D-Tran itself, which is one of our big electronic referral sources. And we would assist and connect with them, work kind of in a partnership to make sure those individuals get the assistance.
Thank you, Mikhail. I don't know if you were planning to cover this later in your presentation, but would you mind providing like the addresses of the Bridge clinics and or phone numbers and contact information at some point, whether that's in the chat or whether it's in your presentation? And then, because there's some questions about like, who do we actually contact to make a referral? Is it formal, or should we just call or tell someone to walk in? So can you go over, I guess, in a little bit more detail what the process is that a provider use to connect someone?
Absolutely. So in about maybe 2 or 3 slides, I'll have all addresses, phone numbers.
Oh, perfect. Thank you. Thank you.
Yep. So I know some things is a lot better to see it, have the time to write it down versus just hearing somebody say it.
Perfect. So we'll get there. Thank you so much.
You're welcome. So a little more about the services provided. One of the big things that we noticed across all of Delaware is the need for transportation. Transportation being something that's hard for most, especially let's say Sussex County. Everyone doesn't have a vehicle. So a lot of people may want services, but they don't have access to them for something like that. So we've partnered with rideshare and things like that. Most sites also have state vehicles that they assist with transportation to help people get to and from appointments or even to the bridge clinic if that's what's needed. We also provide DARTCAN and NARCAN training and community outreach. So again, any situation, we never turn you down. If we can assist, we'll connect you with someone who can. So as far as the process, that's what you had mentioned. So any referral source, they could call directly to any site. The preferred process is to use DTran, which I believe Alexia will cover a little bit later. So that is the preferred method. So make sure I mentioned it. And that's as simple as I think most providers at this point have a login for it. And you just log in, brief details about the situation and demographics, name, number, and the means of contacting. And we would just reach out to the client and schedule everything for you. But it's similar to if you did call directly to the site, that we would reach out to the particular client and schedule an intake and conduct mental health evaluations, substance abuse evaluations with a social worker and a certified peer, and find a referral source for them. So each site, as I mentioned earlier, they have an attending psychiatrist or psychiatric residents, nurse practitioners, psychiatric social workers, majority of which are licensed or due to be licensed shortly, certified peer specialists. Of course, there's administrative staff, and then there's drivers are certified as well. So at every level and every contact they make with an individual from the Bridge Clinic, they're getting quality treatment with individuals who are knowledgeable of the process, knowledgeable of substance abuse and mental health. Each individual is trained appropriately for trauma, for addiction, and things of that nature. And here is the slide with contact information as well as addresses of respective locations. So Newcastle's site, one thing note about that is it's 24/7. So there are always individuals on site. Kent County and Sussex County, because they are in state service centers, they are 8 to 4:30. And the Hope Center, which is a little different, Monday to Friday, 8:30 to 9:30, Saturday and Sunday, 8:30 to 6:30. So the individuals who reside at the Hope Center, most of them are referred through a 201, and I believe they also accept some from some police officers as well. But those residents reside at the Hope Center, and they're receiving services from the Bridge Clinic there.
So just to jumping in here again, Mikhail, just to make sure that folks understand, the folks can just walk up to the Bridge clinics in Newcastle, Kent, and Sussex, except for the Hope Center, that's only there for people who are living there. Is that correct?
Yes.
Okay, thank you. All the other sites accept walk-ins.
Yes.
Okay, thank you. And speaking of locations and contact information, there was a question in the chat about how do providers access the DTRN for making referrals?
Ms. Alexia is going to review that as soon as I'm done.
Oh man, okay, we just keep getting ahead of you. I apologize. I apologize. Thank you.
No, you're fine. Excellent questions. Definitely excellent questions. DTRN is a very powerful tool, so that's something that's needed, and I'd rather her cover it in full because she'll tell you exactly how to get access to it and any other things, documentation things that are needed in order to gain access.
There are two small, or there's one smaller question and then additional question in the chat. So what is a certified driver?
So certified driver, everyone's licensed, and most of the drivers are peer certified or have a level of clinical background that makes the engagement a little more, less Uber-like, if you will.
Got it.
So treatment itself, services don't just start as soon as you get to the physical brick and mortar building. You can start to engage someone clinically, or to even de-escalate certain situations from the very beginning, the first moment of contact.
That's amazing. We also have, do you assist with clients who are in need of mental health services and are not either willing or able to access services and do not meet the criteria for mobile crisis? So this is almost like an outreach team that can meet these literally homeless clients and encourage or offer entry to treatment, especially if they've had encounters with police.
Absolutely. We actually have a whole entire mobile team their job is literally to go to the encampments, which they do in all the counties. So they've been in Wilmington by the bridges and everything. The encampment in Georgetown that we are working towards getting people rehoused. We work heavily with the community in that regard as well. You're welcome. All right. So just brief some of our flyers. So a couple things, just to pinpoint, nothing too crazy on this screen. A journey of 1,000 miles begins with a single step. That's important because we want everyone to understand that just them willing or someone willing to make that first phone call, the initial contact, letting us know that they need help or they would like help, and they're not alone in it. So we can assist and help them walk through the entire process. One of the things when it comes to the social workers and the peer level support is to make sure that we're not using a cookie cutter approach. So there's no one resource that we utilize or referral source that we use more than any other. We make sure that whatever agency we are referring them to are appropriate, ASAM criteria and so forth, as well as make sure that they're a good fit, because it's very understandable to know that every resource is not going to work with every single client. And so just them taking that first step and being able to get the support in a decent amount of time. Decent being, we can do intakes. We can have you scheduled for an intake in less than a week. For most sites right now, you're looking at 2 to 3 days before you can get an intake and be seen and referred. Whereas within the community, I know certain providers that they still have a waiting list of 3 to 4 weeks. And I'm a human like anyone else. A lot can happen in 3 to 4 weeks. And like you said, Aaron, they may not fit crisis, or they may not want to, or even know about crisis. So by us being there and being able to get individuals that service in a decent amount of time, a lot of people are more comfortable. And things are mobile bridge clinic. Most of you have probably seen this touring around Springer, as well as within the community. We work with the food bank, local jails and things like that.
Right. There is one additional question in the chat. Do you assist with out-of-state treatment referrals?
We can and we do. So majority of those would be to the inpatient care. Time and time we'll receive a client who's looking for an outpatient provider, which is a little bit more difficult between insurance and things like that. But if you're looking for inpatient care, then it's something we've done a lot more frequently. I think so. Previously I was the site manager of Sussex. I've sent people to Atlanta, to Florida, I've gotten I've gotten one person admitted somewhere in California. This off the top of my head. So it's not, though primarily most of our resources are in Delaware. We do understand that there are resources outside of it that could be just as helpful, if not more. All right. So as far as the mobile bridge clinic, as I said, you've seen working with the food bank, Springer, Baylor's, Howard's Young Men's Correctional Facility. It's always on the move. They do a little bit of referrals there. Primarily what they do is they'll do brief screenings, seeing what your needs are. And if they can appropriately refer you there, they're also licensed and certified and whatnot. Then for things that they're unable to do on the spot, those individuals are usually referred to the local bridge clinic and receive treatment there. That one. I mentioned the encampment, the mobile bridge encampment team. So I'm not going to go over that unless you guys want more information on that homeless population. Well, that's it. Any questions? Or any other questions I just say?
But we did have a schedule of times and locations for the mobile clinic. I do believe you had that on one of your slides. We will be sending out the slides and all of the other materials along with the recording to everybody as well. So you will have access to those.
Okay. All right. Thank you guys. Continue to enjoy the training or the meeting, sorry.
Thank you.
Erin, I just shared my screen. Just confirming that everybody can see it.
Yes, yep.
I'm Alexia Wolf. I'm the Chief of Social Determinants at DSAM, and I have a brief overview of our recovery support services. These are the resources that we've developed to address the social determinants of health for people that we serve. So once individuals connect with that life-saving treatment, whether it's through the Bridge Clinic or our provider network, we have an array of resources to support people with housing, with employment, primary care, transportation, food security, recognizing that the social determinants of health account for 80% of overall health outcomes. And as I'm sure everyone in the COC can appreciate, the individuals that we serve who have those unmet needs really are able to see a great improvement in their overall health once we start addressing those issues. And we have also found that when we listen to experiential accounts from people in recovery with behavioral health issues, often these are the resources that they really identify as a turning point. Things like getting a place to live, getting a job, having transportation. So these are resources that help sustain people in long-term recovery. One of the newer resources that I'm excited to share with the group is the Opioid Impact Fee Social Determinant Scholarship. We are the recipient of funds from Delaware's Opioid Impact Fee, and the proceeds from this fee are able to be utilized to support wraparound resources for people in recovery who are connected with one of our providers. And to that end, we've had social determinant scholarships using that fund for just over a year now. We've awarded close to $1 million in scholarships, and the scholarships can be used for resources like housing, transportation, food security for people who have current or past substance use issues and are connected with one of our providers. There's an easy to complete form that I'm happy to share with this group, an application request for the scholarship. We typically review those within 24 hours. Often it's much sooner. It is a new resource, and we're eager to get the money out to people who can benefit from it. So if you are considering applying and you're unsure if it's something that we can cover, please go ahead and apply and let us review it. And if it's not something that we can cover through this resource, we want to work with you to try to identify an alternate resource. So again, we're excited to share this with all of you. And then a big focus of our work in social determinants relates to housing. We know how critical that is to people's recovery. And so I have some overview slides for you of our housing continuum for people with behavioral health needs. We have housing with an SUD focus. There are different levels of recovery residences with varying levels of support. We also work closely with Oxford House to support people in connecting with that network of recovery housing. And then for individuals with mental health needs, we offer a range of housing from group homes, which are staffed around the clock, supported apartments, which are income-based apartments with on-site staff support. And then we have in Newcastle County, our targeted case management program, where we have 9 transitional houses. There are also independent income-based housing resources, such as SRAP and Section 811.
Alexia, there's a question in the chat. Do any of the sites work with minors?
DSAM serves individuals that are 18 and above. We recognize the importance of employment as a recovery pathway. 60% of the people that we serve want to work. However, there are low rates of unemployment among people with behavioral health issues. As COVID restrictions have been lifting, we're really excited to be revisiting partnerships for paid apprentice positions with wraparound supports that we're working on developing in the community. These are in areas like construction. And then we also have a partnership with the Department of Labor through our state opioid response grant to promote employment for people we serve, to assist people who may have things on their background that are barriers to employment. So that's something that we're actively working on, again, recognizing how critical that is to long-term recovery. We have also rolled out a new resource for transportation this year called Round Trip. It's something that we started as a pilot within DSAM at the Bridge Clinics, and we just expanded to our providers in Sussex County. Round Trip is an online resource that providers can use to book rides for people in their services for non-emergency medical transportation. So it could be transportation to do things like go to the doctor, get blood work, go to an appointment with a behavioral health provider, things like that. Round Trip takes the provider through a series of questions to match the person with the right level of transportation. So it could be anything from an Uber or a Lyft all the way up to an ambulance. The process just takes a few clicks of the mouse, and then Round Trip does the rest in terms of making sure the person gets to the right place at the right time on the first try. We've had great feedback from our providers and our clients on their satisfaction level with Round Trip. Right now, it's something that we're able to cover the cost for. And it is, as I mentioned, active with our providers in Sussex County. We are looking forward to expanding that statewide in the months to come.
And we have 2 additional questions. So the first one is, do any sites help mothers/parents with young children? And what is the website for Round Trip?
So when you say sites helping parents or mothers with young children in terms of mental health or substance use needs?
Not specified.
Okay, well, I'm happy to connect further with that individual. I can put my email in the chat and all my contact information is at the end, because we do have providers with programs that focus on that population. DSAM just hosted a conference in collaboration with our partners at DMMA for pregnant and postpartum women. So that's a big focus of our efforts right now. And I'd be happy to connect and find out how we can best be of assistance in that area. A big focus of our work is on peer support. In terms of workforce development, we are able to offer free training through the Mental Health Association to people with lived experience in recovery who want training to be able to use that experience to help others. There's a great demand right now with our providers for positions for peer support. These are typically full-time positions with benefits. It's a great employment pathway for people in recovery. And our outreach teams really rely heavily on peers who have their own experience with homelessness. And we found that that's a very effective engagement strategy. And so we really place a tremendous value on the lived experience of those individuals. We have peer centers in each county in Delaware. These are welcoming places in the community that are low barrier, no cost for people in recovery who would like opportunities to participate in activities in the community. Oftentimes they're very appealing to people who might not access our services through a traditional pathway, but have unmet behavioral health needs. And I have a list here of the peer center locations in each county. In Newcastle, we have Creative Vision Factory. There's also a peer center at Horizon House on Maryland Avenue. There are 2 centers in Kent County, at the Brandywine Milford location, and then Hopes and Dreams in Dover. And then in Sussex, they're the 2 ACE centers in Seaford and Georgetown. A resource that we're really happy to offer through the Peer Center at Horizon House in Wilmington is a partnership with the University of Delaware Nutrition Services. And they work with individuals, with participants at the peer centers on options for healthy eating, meal preparation, building a pantry, and they are able to provide one-on-one nutritional consults. So that service right now is available at the Peer Center at Horizon House in Wilmington for anyone in our services who's interested. And then we've also partnered with the Temple University Collaborative on Community Inclusion. They're national experts on promoting full community participation for individuals with psychiatric disabilities. And they worked with all of our peer centers on promoting full community participation for the individuals in those services. And then the last couple of resources I wanted to highlight today are the medical legal partnership that we have with Community Legal Aid. That is a resource that we offer at no cost for people in our services. And we are essentially able to fast track those individuals with community legal aid for issues like utility shutoff notices, eviction, issues with benefits. It's been a great partnership. And my colleague Judy Caprio is the contact for that at DSAM. And then our community homeless outreach right now is with RI International. And then we're in the process of finalizing the addition of Brandywine Counseling for Kent and Sussex County for our homeless outreach. And so their services range from street outreach to connecting people with substance use disorder treatment, referrals for primary care, housing, all of those social determinants. And then I know that there was a question about accessing our online referral system, which is known as DTRAN. I am happy to connect you with our leads at DSAM for that resource. It's primarily intended for our providers, but I can connect you with the right people at DSAM to figure out how best to use that resource to access DSAM services. And I'll pause there for any questions.
think there were one or two in the chat. What was the website for round trip? Was one, and then if somebody qualifies for logistic care, can they also utilize the DSAM transportation program?
Yes, they should be able to use logistic here, and I can drop the website for round trip into the chat.
Another one, how do individuals access the medical legal partnership?
I can put my colleague Judy Caprio's contact information in the chat as well.
Awesome. Right, any additional questions? You guys can feel free to unmute and ask or put your question in the chat.
Hi, this is Lisa Johnson. I do have a question about the referrals. For organizations that don't have access to the treatment and referral network, how do they make referrals? And I'm specifically talking about shelters who have, because I've been going around to the different shelters that we provide funding for through the DHSS Employment Emergency and Transitional Housing Program. And there's a concern that a lot of them receive people who they take because they're coming in referred to for housing through Delaware housing agencies. And people have a lot of issues, mental issues and those types of things. And they're not equipped to deal with those issues, and they don't know what to do, but they still try to deal with the housing, the homelessness of the person and provide the housing. But a lot of people come in having mental health issues that they are not qualified to handle. So that's why I'm asking all of these questions, because I want to send information to this group, telling them about the center and the services that you guys provide. And I need to be able to tell them how to make referrals. So
Right.
That's why I'm asking that a lot.
No, that's a great question, Lisa. I'm really glad that you highlighted that. It's a really important issue. So in terms of people that they're encountering with mental health or substance use needs, my recommendation would be to start with our bridge clinic if they don't already have a provider. The reason that I say that is that our housing resources are designed for people who are at different levels of independence in their recovery. And we want to make sure that we're setting the person up for success in the community. So if it's someone who needs 24/7 support or help with things like meal preparation, we don't necessarily want to put them in their own apartment, where it would be very challenging to maintain. So once we are clear on the level of care that they need from a clinical perspective, then we can work to match them to the right level of housing resource and go through that application process.
Right. So the agencies should just call. They don't need a referral form. They don't need to make a formal referral.
We try to keep it as low barrier as possible. So once you have their level of care and we're able to zero in on the housing resource that's the best match, that's when things like the SRAP application would come into play, and there's an application process. But in order to just get that ball rolling, I would say to start with our bridge clinic, and that would be the best way. But I'd also be happy to connect offline, with other people from my team and from the DSAM team, so we can be sure we have a complete understanding of what you're running into, and we can partner with you on that. And we're also happy to meet with any agencies with your teams to go over these resources. We recognize how busy you are, so we can work with whatever time you have available, but we're always happy to come out and orient your team to these resources as well. And then the contact information for my group was at the end of the slides. Again, if you're running into a roadblock with resources, we're always glad to talk it through and just make sure in terms of the resources we have that we've covered all the bases.
I appreciate that. I will send the information out. Once I get the slides, I'll have your contact information, and then I will send that out to the directors for those programs, and they can reach out to you when they're having issues. Thank you.
Excellent. Thank you.
There was another question in the chat. Does the Bridge Clinics offer training?
Training in terms of what type of training are you asking about?
Tony, would you like to unmute? She says education. If you want to unmute and ask like around what type of subject are you thinking around training, like education for?
Hello, everyone. I'm speaking about training about, Narcan training, education about different mental health, substance abuse, alcoholism. Do you offer the community like us some type of training?
We do have training resources at DSAM. And I see Michaela is still on. I'll let him speak for the Bridge Clinic. But yes, just broadly, DSAM is able to offer that type of training. And again, I'm happy to connect with you and connect you to our training unit.
Thank you.
Thanks.
Hi, this is Anna Conaway from Social Services. I just had a question as far as like what housing resources could someone who is on the SRAP and 811 list access in the meantime if they're not necessarily, the shelter system, is not necessarily equipped to accommodate their level of like mental health or substance abuse needs, whether they're either in substance abuse recovery or not, and there's still existing mental health systems. Because that's a big barrier that we encounter, that we have, a lot of people on the SRAP list, but they're currently facing literal homelessness because the shelter system, they're just not fit for that type of environment, like congregate living environment.
Sure. It really depends on the individual, on their needs. We try to tailor the resource to that individual. One of the things that we have been able to utilize in situations like that is a hotel where we provide 24/7 wraparound supports. So we have a program through RI International called Restart of case management. We've had success with adding that resource if someone is in a hotel while they're awaiting permanent housing. So that's one resource. We also have the supported apartment program statewide that is transitional apartment living with 24/7 on-site support. And then we have in Newcastle County, the DSAM targeted case management program with 8 houses, I should say, with 3 bedrooms each. And Anna, again, I'm happy to share more detailed information with you on these resources.
Yeah, that would be awesome. Thank you. I appreciate it.
Certainly.
All right, if there are no more questions, thank you so much, Alexia and Mikhail, for all of the information. I think it was really helpful, and we look forward to sending all of that out to everybody.
Thank you.
All right, guys, we are actually moving pretty quickly, so we might get out a couple minutes early. So that's exciting. The last bit of stuff we have are just some upcoming events. So the COC is hosting a racial equity training series with Pathways to Housing PA. We've had our part 1 already, which was understanding racial disparities in homelessness, and you can access the training materials at the link there. I'm not sure why it's not showing up in blue, but it's definitely hyperlinked. Part 2 is happening on May 24th from 12 to 2. That will be on implicit bias, and you can see a brief explanation of the training there. If you want to access the full flyer, you can do so by selecting the training name, and you can register for that event there. And finally, part 3 of the series will be on July 19th at the same time from 12 to 2, and that will be on culturally responsive services. And again, you can access that registration there. This is a save the date for an upcoming LGBTQIA plus training series that we are hosting with Transitions Delaware. It's going to address a lot of the issues facing the LGBTQIA plus individuals experiencing homelessness. The first training is going to be virtual, and the remaining are going to be hybrid, in person, and live stream. All of the trainings will be from 10 a.m. to 12 p.m. And these trainings are going to be required for COC funded providers, but are highly encouraged for ESG funded providers and anybody else who is interested in learning about the topic. There will, and you can see the dates down below. We will be sending out more descriptions and registration and stuff like that in the coming months, but those will be over the summertime. Then we have the 2022 Day for Housing, days for housing. So those are going to look a little bit different this year. Starting next week, we are going to have an advocacy training, which is going to cover how to engage with legislators around housing and homelessness issues and the legislation that's going on right now. There will be a virtual forum to cover housing issues from the national and local levels, and gather with other professionals in the field. And then finally, we will be doing a day of meeting with the legislators, which is where we will go to Legislative Hall and actually engage in advocacy. So the registration and dates for all of those events are available here. You can also go to Housing Alliance Delaware's website as well. Anybody who's interested in that is also welcome to contact Sonia, our new policy director, or Wes, our policy and community development manager. Upcoming from HUD. So next week, HUD is having a webinar around building effective partnerships with the Justice Department for people leaving prisons and jails. So trying to create a better pathway from prison to housing options so that people aren't exiting into homelessness or increasing their chances for recidivism. So we'd highly encourage anybody to attend that. Again, anything, I'm not sure why it's not showing up as the link, but all of the things to go and register, you can just click on the slides. They're all linked there for you guys. HUD is having a conference in early May for serving communities through housing counseling. So that is also going to be a very, very interesting conference. Sorry, brain skipped a beat, but we're back. It's going to focus on learning about the different programs from community development to affordable housing, and how to support the needs of people experiencing homelessness and other special need populations. So it's free and it's virtual, so you can register for that as well. University of Delaware, Wednesday next week is a big day. There's lots of stuff going on Wednesday next week. University of Delaware is also holding a webinar on Delaware's affordable housing crisis, using data to drive action. You can see a little bit of information about that there. And again, you are able to register following the link in the PowerPoint. And the National Fair Housing Training Academy is also holding a webinar around bridging the racial home ownership gap and the special purpose credit programs. So that will be today from 2 to 4. I do believe you have to register to get the link, but I don't think that there is any cap on registration. So there's still time for that. And then we are moving into announcements. So Pathstone Youth Programs wanted to announce their job training and support and skills readiness program for youth who have criminal background histories living in Newcastle County. So you can see the flyer there, as well as the information for the training and employment manager, Emily Ulrich, as well as a detailed presentation about the program that they provided to us for that announcement. We talked a little bit about transportation during the DSAM presentation, which leads us right into this, which is the Dover and Kent Metropolitan Planning Organization. They have announced their draft transportation improvement plan for 2023 to 2026, and it's currently open for public comment. We are highly encouraging organizations or individuals serving people experiencing homelessness to review and provide comment on the transportation improvement plan and how proposed projects may affect those that you serve experiencing homelessness. So any public comment can go to the contact information there, Helen Wiles at Dover Kent MPO, but please take a look if you are in the Dover Kent area and you are serving people experiencing homelessness. The National Network for Youth has a vital document legal hotline for youth. So youth struggling with homelessness may need legal advice to understand their options in obtaining their vital documents. Those include things like ID cards, birth certificates, social security cards, and documents needed to obtain an ID or license. They can't provide legal advice, but the hotline does help with any steps to obtain those documents. So those numbers are there. From the Social Security Administration, they released several press releases recently. One discussing the in-person services resuming as of April 7th. So they are having selective in-person services. There was the release of the Social Security Equity Action Plan, and there was the notification that the Social Security is now allowing self-attestation of sex marker on your Social Security records. So any questions or information or access to those documents, you guys can contact Matthew Baxter. He is the public affairs specialist, and that is his contact information there. And finally from me, just Wilmington Head Start has announced that they are enrolling for the 2022-2023 school year. So that is important for any providers in the Wilmington area who serve women and children who have school age, preschool aged young children. So those are all of my announcements. At this time, I'd like to open up the floor to any of the membership that is on who has any other announcements or upcoming events that they would like to let everybody know about. All right, and if we do not have any announcements, then the next meeting will be on April 20th from 10 to 12. And if you guys have any questions, any information you'd like to include in the PowerPoint next time, or any ideas of information that you would like to see coming out of the COC, please feel free to contact me. And I appreciate everybody attending today. Thank you so much.
Hey, Erin?
Yes.
Erin, that's today's meeting.
Oh, it's been a long week. It'll be July 20th. I'm sorry. It's in July. I'll update that before the slides go out to everybody.
Thank you.
Thank you. It was almost perfect. I got through all of it until the last slide. Anything from anybody else? Okay, well, thank you, everybody. We will be sending out the materials and the recording on later this week. We appreciate your time. Thank you so much.